So I think in this country, we've taken a very liberal approach to mortality, and I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? You hear from coroners that that's not necessarily the case. Or are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
Dr. Birx was asked a question regarding COVID-19 and people with comorbidities. So, for example, diabetes, heart disease, you name it. She got up on stage and she admitted in public that when someone comes in and they get tested for COVID-19, they could have 3 or 4 other major debilitating disease things to them, right? Like they're actually dying of emphysema or congestive heart failure or diabetes or a heart attack, whatever it is. They're labeling those people who pass away, they're labeling those COVID-19 deaths. What that means is the number that you watch on your news, which I'm not watching the news, but I've seen enough of the TV screen to see that they're putting up the death stats, basically, of COVID-19. The numbers they're giving you are completely BS. They're lying about it. The numbers for America are completely untrue, and we don't even actually know what those numbers are. And it's so unethical. Now, I've understood she's not a practicing physician anymore. She doesn't have a license. That's fine. She's still a doctor. You still have your doctorate degree. But the unethicalness of what they're doing is mind-boggling. That means a physician is diagnosing people with COVID-19 as a death, and the coroner would have to be involved, versus those people actually died of something different, and that completely skews the number. Like, this is, like, that is, I don't even know, in the health world, that is, unethical is the only word I can come up with, but, that is so out of ethics, it's unbelievable. I can't believe she actually admitted it. I can't believe she went up there and stated that, because Twitter exploded after she said that. And I actually have friends who are in the chiropractic world, but also in the medical field, who are posting after that. They couldn't believe that she admitted to that, because that's just blatant lack of ethics.
When you give communities the information that they need to understand what's going on, and you're transparent, that communities can be part of the solution in a transparent and amazing way.